I'm Andrew Brown. I have the privilege of overseeing child and family policy here at the Texas Public Policy Foundation. And I love my job because I spend every single day fighting for the most important institution in history, which is the family. And our conversation today is about an important topic that's impacting children in the state and all across the country. It's a topic that has gotten more and more attention as the years have gone on. And it's the issue of gender medicine and procedures being performed on children being given medications and surgeries at early ages. According to a report late last year by Reuters News Service, the number of gender clinics treating children in the United States has rapidly grown over the last 15 years. In 2007, there were exactly 0 pediatric gender clinics in the United States. Today, there are more than 100. And services provided by these clinics range from psychotherapy to prescriptions of medications like puberty blockers, cross-sex hormones, and even certain surgical procedures. As the number of pediatric gender clinics has grown, we've also seen a growth in the number of children diagnosed with gender dysphoria. A study by a group called Komodo Health Incorporated that was also cited in that Reuters report found that nearly 122,000 children between the ages of 6 and 17 had received a diagnosis of gender dysphoria between 2017 and 2021. And of these, 42,000 were diagnosed in 2021 alone, which was a 70% increase from the year prior. Clearly, something is going on, and the public and lawmakers are beginning to take notice. And if you're in this room today, you know that this is a hot-button issue that is going to play a prominent role during the 88th legislature. And I'm honored to be joined by 3 of the nation's foremost experts on this topic so that we can unpack this debate together today. At the end of the row here, Chloe Cole, who many of y'all may recognize, is a speaker and activist who has become probably one of the, if not the leading voice in this debate over pediatric gender medicine. And we will get into her story later on, so I'm not going to steal the thunder by giving the full bio bullet points. But she has lived this, and she is now working to protect children just like her. Next to me, Dr. Tom Oliverson is a member of the Texas House of Representatives representing Texas's 130th district, which is Northwest Harris County. In his professional career, Dr. Oliverson is a board-certified anesthesiologist and partner at U.S. Anesthesia Partners. This is the largest anesthesia group in Texas. He was selected by Speaker of the House Dade Phelan to chair the Committee on House Insurance. He also serves on the Public Health and House Administration Committees. Additionally, Dr. Oliverson was selected to be vice chair of the House Republican Caucus. He's authored legislation on a diverse set of issues, including healthcare, education, local government, religious freedom, the Second Amendment, protecting the unborn, and most importantly for our purposes today, protecting children from permanent medical procedures. And between them is Dr. Jay Richards, Ph.D., not M.D., so we have an M.D. and a Ph.D. on stage with us today. He is the director of the Richard and Helen DeVos Center for Life, Religion, and Family, and the William E. Simon Senior Research Fellow at the Heritage Foundation. He's also a senior fellow at the Discovery Institute and executive editor of The Stream. His research at the Heritage Foundation focuses on the threat of gender ideology in our culture, medicine, and education. He's also the creator and executive producer of several documentaries, including 3 that have appeared widely on PBS stations. Dr. Richards' articles and essays have been published in the Harvard Business Review, the Wall Street Journal, the Washington Post, the New York Post, Newsweek, Forbes, Fox News, and many others that you may read, many of you have heard of and probably don't read. Please join me in welcoming our panelists today. So Dr. Richards, I'd like to start with you and ask you to help us frame the conversation by briefly explaining this phenomenon of gender ideology and how it has risen to prominence in recent years.
Okay, so there's a 45-minute lecture I'm not going to give you on the intellectual origins of this thing. So think of it as a toxic witch's brew that combines several intellectual streams. One is critical theory, which is a type of cultural Marxism, which you get Marxist conflict theory applied to culture. Another is French postmodernism, which is kind of also related, but denies the existence of our knowledge of objective truth. And then the kind of refraction of these things into various theories or studies. So gender theory, queer theory, anything you hear about a department that has studies at the end of it usually isn't a manifestation of this. There's some exceptions, all right? So what is it, practically speaking, as it's come to be, say, calcified in school curricula? It basically boils down to this claim. And so if you've not thought about this before, it sounds insane. I understand that, but this is what it is. Gender ideology displaces the sexual binary. That is, the idea that mammalian biology applies to humans, right? That there are two sexes corresponding to two different body organizations and different gametes, right? That describes how we sexually reproduce. It displaces those categories of male and female as real things, and it sets in its place two subjective ideas. Sex assigned at birth. So sex, rather than being something that's observed, is something that is a social construct in which a doctor just assigns a sex. And then, rather than us being embodied sexual beings, what we really are is this disembodied psychological self that we call a gender identity. And your gender identity is fundamentally independent of your body or your sex. So your gender isn't just male or female, right? It's not. It can be, incongruent with your bodily sex. It can also be non-binary, which means that you're neither. It can be two-spirit. I don't really know what that is, but there's a lot of different possibilities here, because you can see once you detach the self from the body, it's not moored to anything. And so this is how you get the idea that gender-affirming care involves changing pronouns, social settings, hormones, and a person's body to conform to the internal gender identity, as opposed to helping a child, say, adjust his or her thinking to his or her body. See, all of this falls into place if you get that that's what's happened. Sex has disappeared, and an internal and purely subjective idea of gender identity has taken its place. Now, how did this happen? It's happened over about the last 30 years. Gender ideologues were working their way through our institutions, through teachers' colleges and law schools, and setting up programs at colleges that have studies in the name, right? Working their way into medical organizations and medical associations, and then a few really rich billionaires that have funded this thing. That's how it happened. Most of us didn't notice it until it broke out and we suddenly discovered it in our kids' schools.
And Chloe, you have been directly impacted by this ideology, and many in our room, like I said earlier, may be familiar with your story, but it's an important story that needs to be told. So to start off with, you've described yourself as a former trans kid.
Right.
At what age did you start identifying as transgender?
I was 12. I started socially transitioning at 12.
And explain that idea of social transition.
So for me, it involved cutting my hair shorter, buying more boys' clothes, and changing my name, trying to change my mannerisms to be more like that of my male classmates.
And so at 12, you began this process, and as I understand it, you wrote a letter to your parents.
Yeah.
Telling them that this is how you were identifying and that you wanted to be a boy and you wanted to get on medications. What influenced that decision for you? How did you come to saying, okay, this is what I want, and how did your family react?
There were a lot of factors that influenced that. One being that I had undiagnosed body dysmorphia. I wasn't diagnosed until after I stopped transitioning, actually, but I started puberty at, I think I was 8 or 9, and I had to deal with my peers, my classmates, and sometimes teachers or adults making comments on my developing body. And this made me really conscious from a young age. And I started to compare myself to other girls my age, to the older women in my family. and the women that I would see on the screen. Like I started using social media when I was around 11 because that was when I got my first phone. And I mean, everybody else my age was using apps like Instagram, Snapchat, stuff like that. And I started using Instagram, and I was bombarded with these oftentimes very sexual images of young women pretty much as soon as I made an account. And you know, at the same time, I was kind of a tomboy. I had a lot of my interests were on the nerdier side. I liked video games and comics and cartoons and things like that. And like I would see a lot of posts having to do with those things, but for some reason in the communities around those things, there were like a lot of young like teens and adults who identified as LGBT, like, especially as like non-binary or trans, and there were a lot of girls my age who identified as boys. And I started getting more posts like having to do with them, like personally in my feed, like they're about their lives, like their childhoods, their sometimes like relatable memes they would post, and I felt like I had a connection to these people because I was very similar to them, especially in like my childhood and some of my struggles growing up. And I started to wonder, like, well, what does this have to do with me? Like, how do I relate to these people? Like, what is my sexuality? What's my gender identity? Am I even a girl? And you know, I switched between labels like bisexual, pansexual, and different gender identities before I decided that it just made sense that I was never a girl in the first place. And that was why growing up I felt like I never really related to other girls or women in my family, why I felt so poorly about my body.
So what happened after you let your family know that this was a course of action that you wanted to go down and explore the medical side of transitioning?
I mean, my parents, they didn't really know how to respond to this. They're pretty shocked. They never heard anything like this from me before, and I don't think really any parent would expect to hear this from their own kid, but they didn't really know much about the subject, and they wanted the help of professionals, and so they sent me to a therapist. And I think their expectation was that like they would get to the bottom of where these feelings were coming from, that they would allow me to wait until I was 18 to make this decision, and that these feelings would probably just be a phase, and that they would go away by the time that I was an adult. But none of this happened. As soon as I saw the therapist, he just started referring to me by my preferred name as a boy, as the son of my parents, and it was just accepted that I was a boy and that transitioning was the only path forward. I mean, my parents were really concerned. They didn't want me to make a decision like this until I was 18 at the very least, when I would be legally responsible for myself. But the doctors told them, like, they didn't really give any other options. They said that the rate of regret is less than about 1 or 2%, and if I wasn't allowed to transition and be comfortable in my body, then I would be at risk of suicide.
So how quickly after you started seeing the therapist did you progress to the puberty blockers and hormones?
I'd say about like a month or two after I saw the therapist, I was referred to a gender specialist who diagnosed me with gender dysphoria, and then referred me to a few endocrinologists. And then just 6 months after the diagnosis for gender dysphoria was when I was put on puberty blockers. And a month after that, I was put on testosterone. I was 13. I was 13 at the time.
You were 13 when you
and
were
I was in 8th grade.
And eventually progressed, as I understand it, to a double mastectomy around age 16, what they call top surgery?
I was 15, yeah.
You were 15. Oh my goodness.
It was the summer after my sophomore year.
What led you to make that major decision to go from medication to surgery?
I mean, before that, I also started binding my breasts using a compression device called a breast finder. And I didn't start binding until after I started on hormones, which is kind of unusual. Usually people start doing that as part of the early social transition process. But I mean, at the time I was fairly young, and I wasn't particularly physically developed, and so I never really paid much mind to the appearance of my chest, because I would often wear like baggy hoodies and t-shirts. But there was an incident in my 8th grade year when I had actually been sexually assaulted by another student. And after that, I didn't want that part of my body to be visible anymore. I didn't want to run the risk of being, in high school, being found out as a biological female, and of being subject to something like that again. And so I started to buy a binder and start hiding that part of myself from the world. And I was binding for about, I'd say like 2 years, and I got sick of it pretty quickly. I mean, it felt nice to not have that part of me showing through my clothing, but it was kind of grueling at the end of the day to come home. Like, I live right in the middle of California. It gets up to like 115 degrees on some of the worst days. And I would walk home in like 3 layers of clothing, like jeans, a t-shirt, this compression device underneath, and like a hoodie. And I would wear this whenever I went out of the house, pretty much. Maybe for around like 8 to 12 hours a day, because I'd go to school in this thing, I'd work out and swim in it, and I just wanted to be done with it. I hated wearing it. And I started to, after a while, think of myself as just like any other boy my age. I mean, I looked like one, I sounded like one, I acted like one, and I wanted my body to reflect that. And so about halfway into my sophomore year, I started expressing to my therapist, I want to get my breasts removed. And so I was sent to another gender specialist, and after only, I think it was 1 appointment, I was given a letter of recommendation to a surgeon. And I had about three or so consultations with the surgeon. And just after 6 months, I actually underwent the mastectomy.
So all during this process, as you were going through the medical procedures and post-surgery, did you feel that the struggles that you were having, the sense of unhappiness that led you down this path, was it relieved at all? Did you feel happier?
I mean, temporarily, yeah. There was a bit of a honeymoon period with all these treatments, especially the testosterone and the surgery. So it was kind of hard to pinpoint where the issue really was, but in the end, I ended up feeling worse. And it wasn't accounted for before I went under the surgery, but just a month before the operation, I actually had like a note of leave from school from my psychologist because I was in such a bad state. And I was still allowed to go through with the surgery.
At what point did you regret these decisions and decide, I want to detransition?
It took a little while. I mean, just after the surgery, like when I woke up, it was an outpatient surgery. So pretty much as soon as like the medication wore off and like I was able to walk around, I was sent home. And I mean, I felt happy about it. I was looking forward to recovering and finally being able to take my shirt off and swim shirtless and things like that. And that actually never happened because I'm still having complications from the surgery. But I was kind of comfortable because, you know, my mom had to take some time off of work to take care of me in the post-op process because it was a major surgery and the upper part of my body, and so I pretty much lost all range of motion in my upper body, and I didn't really have the strength to do certain things around the house. And my mom would have to like cook with me, assist me with stuff around the house. But about like a week later, I think was when I got my stitches taken out, and it was horrible. All the dressings were taken off, and that was the first time I really had to look down at this wounded area on my body. And it was numb, but it wasn't comfortable. I could still feel everything, and it felt like there was like electric shocks just jolting through my body. And I almost threw up during the thing. I couldn't handle it. And once I went home, that was when I was able to take showers and baths again. That used to be one of my favorite parts of the day, but then now I had to take care of this part of my body what's left of it now, and have to clean the wounds and redo the dressings every time after I took a shower. And that's kind of when reality started to hit. And eventually I started realizing there were a lot of things that I missed about being a girl, like on the social side of things especially. The grass really is greener on the other side. When I was growing up, I had the impression that men had it better in just about every way, but that's pretty far from the truth. I mean, I found that as I settled into a more masculine role socially, I became really lonely. I didn't really have as much space to really talk about like my emotions or bond with people, and my relationship with my family, with my siblings, with my mom and dad, even with my friends at school. It was a lot less emotionally fulfilling. And I even started to miss things like having long hair or wearing makeup or just looking more feminine in general. But I didn't really feel like I had anybody to talk to about this, and so I kind of internalized it. I mean, sometimes I would wear like my old girl clothes and like buy makeup sometimes from the drugstore, but I felt very trapped, and I started to get worse. And by this point in time, my school performance and attendance were probably at their worst. It wasn't until my junior year, during the second semester, I was taking an online-only program because I had to drop out of school just because of how poorly I was doing mentally. But I was in a psychology class, and towards the end of the unit, I learned about things like childhood development and parenting and the family, and how important all that is to a person psychologically. And I mean, during the consultations, like for the hormones, I was told like I might have difficulties conceiving children later as an adult, and after the surgery I wouldn't be able to breastfeed. But I was between the ages of 13 to 15 when I had those consultations, and I didn't know what any of that really meant. I didn't know then that I would want to have children, because I was a child. But that was the first time that I'd really thought, after I took that class, that was the first time that I'd really thought about those things and how that would look like for me and whether I wanted to have kids. And I realized that not only am I not going to be able to have that experience of breastfeeding and nurturing my kid naturally, depending on the status of my fertility, I might not even be able to have kids. And that realization was just devastating for me. And that was when it really started to click for me, like, this was the worst decision I'd ever made in my life.
Well, thank you so much for sharing that story and being so open and vulnerable with all of us. And, you know, obviously we'll get to the policy side of things and really want to hear, you know, about your activism and your work on protecting kids. But Dr. Oliverson, I'd like to bring you in. You're one of just a few medical doctors in the Texas legislature, and this is something that you're championing this session. What inspired you to take a leading role in this debate at this time?
Well, so last session, this bill was filed and carried by my good friend, State Representative Matt Krause, and he came to me early in session and we talked about it. And I didn't know a whole lot about the issue, but obviously the more we talked about it, I became very supportive of what he was trying to do, and kind of became a co-laborer with him on it. I think the thing that was really shocking to me was when the bill had a hearing in public health last session, and we had a doctor who came as an advocate, supposedly, to talk about this issue and basically sort of set us all straight on the medical science that we just didn't know. And then we literally realized during the middle of the hearing that we were being lied to. You know, this person is testifying before a House committee and basically got trapped multiple times into making untrue statements. First about reversibility of the procedures and the treatments that were being done. Then, Chloe, you'll find this interesting. She basically said that there's no such thing as a child that's having gender-conforming surgery before the age of 18. And I said, really? And she said, well, except for a double mastectomy. But that's reversible, she said. Right, no, but she said it's reversible. And I said, it's reversible. I'm a board-certified anesthesiologist. I've been involved in hundreds, if not thousands, of breast surgeries, reconstructions, tram flaps, mastectomies. I know that's not reversible. It can be rebuilt, but it will not ever be reversed. And then she became very cagey about it, and then we subsequently found out after the hearing, one of my colleagues found out about the fact that she was actually a faculty member at UT Southwestern, and that this clinic was being, you know, at least partially run under the auspices of our state. And so that upset us greatly. You know, we felt like we were just trying to get to the bottom of the, you know, find the facts and truth. So that kind of set the ball in motion. Andrew, you and I visited before session began, and I remember our conversation. We talked about it, kind of, you know, well, what do you think about it? And I started sharing sort of some of my perspectives as a doctor. And look, and I'll be honest with all of you in this room. Part of my motivation for taking on this fight is that I believe that the errors we've made in this gender medical experiment is actually one more manifestation of the fact that science has been corrupted by politics, and we are in serious danger of losing the scientific method. And that became really apparent to me during COVID when I saw people literally on both sides of the issue just making blatantly stupid statements on social media. Well, I gave this drug to a handful of my patients and nobody died, so that proves it cures COVID. That's not a study. And then on the other side, I get people saying, no, that drug doesn't work, and we published the study in the Journal of the American Medical Association, and then, oops, find out that article has to be retracted because they falsified the data. And so you all saw this play out. You know what I'm talking about. I mean, the degree to which the politics has gotten in the way of good science, particularly on the issue of pediatric, you know, medicine regarding, you know, gender, this whole conversation. There are not good randomized controlled trials looking at this issue. There are a handful of studies. They're mostly anecdotal, case series. It is literally the worst quality of scientific evidence if you were to stratify quality. Case series, case reviews, chart reviews, retrospective stuff is literally the lowest quality. And that's what these organizations are holding up to be the gold standard. But as you point out, Chloe, you know, the more research I've done on this, what we're doing in America doesn't even comport with what's going on overseas, where they have far more experience in dealing with these issues than we do. You talked in your story, I heard there were several things you said that jumped out at me. One of them was the fact that you were allowed social transitioning at a very young age. And the gold standard that they talk about in gender medicine, the Dutch study, basically completely rejects the idea of social transitioning prior to intense psychological counseling and therapy for a period of no less than 6 months. And the reason is because it just muddies the waters. It confuses the issue, and I would argue to you that with social contagion, which we know is an issue in adolescence in a wide variety of things, it creates a situation where people are inclined and conditioned to think of themselves differently. And that's a problem because, look, science is fact-based. And I can poke holes at science, and if it's real science, it stands on its own 2 feet, and it pushes back at me. I can prove to you that gravity's in effect in this room. Any of you can pick up something and drop it, and you know gravity's in effect. Facts are facts. But when we see things like what's happened with the American Association of Pediatrics, where they've suppressed internal debate within their own organization about the validity of these pediatric medical treatments for gender dysphoria, that's not science. Science is welcoming criticism because science uses criticism as a way to validate itself. That's not what we're seeing here. And so that's part of my passion, and that's the reason that I'm engaged in it. I'm concerned about the science. I believe we're practicing bad medicine, and I want it to stop.
While we're on the subject of how to make it stop, Dr. Richards, you've been all over the country talking with lawmakers about how they're responding to this issue and advising lawmakers on what's the proper way to go about protecting children from the medical procedures that Chloe went through. Tell us a little bit about the current national landscape and how various states are seeking to address the problem.
So this is the year that states push back on this stuff, 2023. I mean, this is the fulcrum year. A few states had tried to deal with this earlier. There had been an earlier initiative in Texas. The first bill that was passed and actually vetoed by a Republican governor was in Arkansas, but it was overridden by the legislature. So it's a complicated story there. I can say this, but involving spineless Republicans, frankly, but that which is half the issue. You asked me the question. This is half the issue because we're dealing, even in states with Republican supermajorities, there's a lot of squeamishness about this. There's also this kind of basic reality that people initially think, okay, this can't be happening, it can't be prevalent, or it's just happening maybe in California in one place. And then when people realize what's happening, you're outraged. If you have functioning cognitive faculties and a conscience, you're outraged. And so the instinct is, okay, what do we do to destroy this, right? I mean, let's just criminalize it. We'll declare it child abuse. We'll round up. We'll close the clinics. Okay, we got to do things constitutionally in this country. And so there are better and worse ways to respond to this. The good news is that there are 18 states in this country that have bills that do this as well as I think can probably be done. And the bills in Texas, it also helps to have a House and a Senate bill that agree. That's always very nice, like you have in Texas. But also what we want to do at this stage, you got to accept the reality. Here's the reality. We are running an uncontrolled experiment on kids around this country. 100 of these pediatric gender clinics, plus half the Planned Parenthood clinics are dispensing cross-sex hormones, right? I mean, it's the Wild West. At the same time, major medical organizations or professional organizations like the American Academy of Pediatrics, WPATH, the Endocrine Society, the American Medical Association, all say this is the proper standard of treatment. The American Academy of Pediatrics has guidelines that explicitly say this is basically the best way to treat kids. There's not an alternative, and if you don't do it, you're going to increase the likelihood of suicidal ideation. All right, so imagine you're a judge, right, who has to deal with a lot of different stuff. And so let's say you're in the state of Alabama. I'll just use Alabama because they had a bill last session that made this a Class C felony. So it would make these procedures a Class C felony. And so you could imagine how this goes. And so a judge gets this case, and lined up on one side is a bunch of official medical spokespersons speaking for science, right? And now, if you're not a specialist, if you're not a scientist or a doctor that can read the literature, you just have to kind of trust these folks, right? And then on the other hand, you have the gentleman from Tuscaloosa saying it should be a crime. And so you can see the bind that puts a judge in, right? It's because, okay, is he going to side with the politicians or is he going to side with the scientists? You can kind of guess how this is going to go, right? And so legislative responses to this have to be careful. Have to sort of don't get out ahead of the evidence, don't overstate things, and also deal with the kind of muddiness of the situation. And so Texas, for instance, it's not criminalizing. Again, it prohibits these procedures. It prohibits expenditures of public funds for these procedures and things like that, right? So that changes the incentive structure for doctors, but it doesn't go after parents, even some parents that maybe are, a little bit crazy on this, frankly. There's some parents, some subset of parents that are almost evangelists for this thing. That's maybe 10%, though. Most parents are like Chloe's parents, right? They're sort of blindsided. Their doctors tell them this is the right thing to do, and they're just sort of dragged along. So we don't want to get between parents and kids, and we don't want to punish parents that are themselves victims, and we don't want to do something that's so draconian that it makes it difficult for a judge to sort of decide what to do. And so Utah has passed, and a governor has signed a bill. Same thing has happened in South Dakota, and now Mississippi. And then several other states will do this in this term. Texas and Florida are the two to watch. And I'll maybe talk about a little bit like Florida's done later. Frankly, because Texas and Florida are the size of mid-sized European countries. They just are. There are 1 million people in Montana, right? So Texas and Florida are massive. And so what happens in these states is really very, very important. Now, small states can play a crucial role too. Remember, Dobbs came out of small Mississippi, right? And it overturned Roe v. Wade. And so that can happen. But what I am hoping as a sort of policy analyst will happen this year is we will get several really, really strong bills that deal with this in a sophisticated and constitutionally appropriate way. They're all going to get litigated. They just are. This is a long game, but the game starts with good legislation that works its way through the courts.
Chloe, I want to go over to you. Dr. Oliverson talked about the shoddy science around these medical procedures. And proponents of performing these types of procedures on children argue that it's necessary to improve mental health and prevent children struggling with gender dysphoria from harming or even killing themselves. How do you respond to that?
Right. I mean, I think people on either side of this issue, I think we're all concerned about the same thing. We're all concerned about the health and happiness of our children. But transitioning kids is not the way to go around it. It's never appropriate for children. I mean, in doing so, in medically transitioning a kid, you're stripping them of what I think is the most fundamental right that children have, which is the ability to grow up into a healthy, happy adult who is able to live a fulfilling life. And if you strip them of the ability to have their own kids, to experience normal sexual function, and of their overall health, they can't do that. They can't live a fulfilling life.
Absolutely. So, if the science is shoddy, if there isn't conclusive evidence that these interventions actually help, and from what I'm seeing, there may be mounting evidence, what we're seeing in Europe, Dr. Oliverson, that these may be causing greater long-term harm, both physically as well as from a mental health standpoint. What are the ethical implications for doctors who perform these procedures?
Well, I think that's an important question, and I think you bring up the issue of, we're sort of not the first place to contemplate and begin asking some tough questions. The National Health Service in England recently, actually last year, issued a pretty condemning report on this gender experimentation in children, which resulted in the complete closure of their gender medicalization and surgery clinic known as Tavistock. when they found that, actually it doesn't appear as though we're actually resolving gender dysphoria. We're still having issues with suicidality. It's not solving the problem. And we believe now we can see clearly that there are lifelong consequences that are above and beyond just the change in your external appearance, things like bone mineral density. You mentioned infertility. There are a host of things that are going on during normal puberty that have nothing to do with, your male and female body parts that are really, truly important. I think it's interesting when you talk about the degree to which kids rapidly transition from puberty blockers to cross-sex hormones. Part of that is because these folks are now realizing that in the absence of some sex hormone, that these kids are not developing normally, period. They're having a whole host of secondary problems. So I think what England did, and what I'm hopeful that we do here, is they basically said full stop on the medicalization and the surgical stuff. It's pretty clear to us now that we're not sure that we're doing the right thing. We may be doing more harm than good. We realize the literature was not what we were told it was. And in the meantime, we continue with the behavioral health support to help these folks. Look, I'm not denying, and I don't think anyone in this room should deny, that a young person facing puberty might find themselves in a situation where they have significant anxiety about the changes that their body's experiencing. But the question that I have, that I think you should all be asking, that I think that Chloe was talking about, is that how you feel at age 11 is not necessarily how you're going to feel at age 21. And why are we doing permanent things to people during a time period in their life at which the future's not set in stone? It's the absolute worst time to do this. And so I think this becomes an unlawful medical practice in our state. You asked me what I think we should do. This becomes an unlawful medical practice in our state. The medical board, in combination with the Attorney General's office, has the power to enforce this. And we'll treat it like bad medicine. Look, folks, this is not the first time that medicine has had to do a right about face on something that they thought was just the best standard of care. Over 100 years ago, but not that long ago, we thought that orbitofrontal lobotomy was the solution to severe depression. And that basically turned people into walking zombies. But at one point, it was thought to be curative. So we have to grow up as medical practitioners. We have to shed the politics. We have to look at the medical evidence, and we have to say to ourselves, are we truly doing no harm? Because I don't believe we are right now.
So as an anesthesiologist, your recommendation for my surgery would not be take this shot of bourbon and bite on this.
I mean, that might be kind of 1883. But I think we can be a little more sophisticated in the 21st century.
Chloe, you and I were having a conversation very similar to this before we came into the room about the behavioral health supports and the mental health supports and how that needs to be factored into the considerations that lawmakers bring to bear in these debates and as they're crafting legislation.
Right. I wanted to add to what he was saying before that. The studies we've done on adults who are post-op, who have gone through the hormones and the surgeries and completed their transitions. The standard of care that we have for dysphoric patients and the argument for transitioning people in the first place is that it prevents suicide. But the outcomes actually are quite the opposite. There was a long-term study done, I think, over the course of 30 years, done on adults who transition, and it found that post-transition, they're actually about 19 times, the rate of suicide is about 19 times higher than the general population. And if that's the outcome we're seeing in adults, how can we expect any better for children? But it's important that we address the issue of childhood transition and prevent it with these bills. But one problem that I've noticed with these bills is that they're not addressing what happens afterward. There are no standards of care for detransitioners, and these clinics are not required to care for patients whose transitions fail. I mean, I wasn't helped at all. I tried to reach out to my gender specialist and everybody who was involved in my transition. I've gotten absolutely no help from them. My gender specialist told me that my failure of a transition was just another part of my gender journey. And when I reached out to my surgeon last year for help with the complications, all I could really manage to get was a 5-minute Zoom call with him. And he was very rude, very dismissive, and he told me just to keep bandaging my chest, but also to put Vaseline on it, which gave me a skin infection. But we need to address detransitioners and to put a standard of care in place for them as well. But also, if we're going to take away the option of transition from dysphoric children, it needs to be replaced with something. And you could argue, like, well, there already is something in place for them. They already have psychotherapy for those patients. But the therapy that they actually use, that they actually recommend, is social transition, which I think is just as bad as medically transitioning because it prevents a kid. I mean, childhood and teenhood are an important time for socialization. And by lying to a kid about who they are and not allowing them to socialize as in the role of their own sex, you're taking that away from them. Sorry, one more thing.
Oh, yeah, absolutely.
Another problem with the affirmative care model is that there's so many cases like me going through the system. I mean, they argue like, well, we do like extensive psychological evaluation, but most of the time that's not the case. They don't really look into the comorbid factors or underlying issues in their dysphoric patients' lives. I mean, I think every single young trans person I've talked to, or detransitioner who I've talked to, they've either had like some trauma relating to their family, like either like one of their parents was not in the picture, they were a foster kid, they had attachment issues, or they experienced sexual assault or abuse, especially at a young age. And yet these patients are still allowed to transition socially, medically, get hormones and surgeries, and it's just never considered as relating to their gender dysphoria.
And that brings to mind something that you and I and Senator Donna Campbell, who has sponsored the companion legislation in the Senate, also a medical doctor in the Texas legislature, have had leading up to this session, which is, yes, we need the legislation to be effective. We need it to be constitutional, to your point, Dr. Richards. But it also needs to be compassionate. Absolutely. So I'd love, this is a question really for the whole panel. Why is that compassionate part of the equation something that's so important to each of you in terms of a legislative or a public policy approach to this issue?
I think it's absolutely crucial simply because it's the right thing to do. I mean, the answer's sort of obvious. I mean, the reality is that when you first are confronted with this medicine and these procedures, you're outraged. But the reality is that it's also a response to something that's happening. One of the myths out there, in addition to the myth that this reduces suicidality, is the idea that we're not actually seeing a massive social contagion. But the reality is, gender dysphoria, until recently, was an extremely rare phenomenon, mostly restricted to prepubescent boys, and almost all of them tended to grow out of it if they were allowed to do that. We have a massive increase in people presenting with these symptoms, and the majority of them are girls. These are people that are struggling mightily. I mean, imagine the difficulty of feeling an alienation from your body. You don't have another one, right? It's your body. And so we have to find the right way to respond to that. not only compassion for the kids that are going through this, but the parents that have, in many cases, gotten sucked into it. And so any legislative response needs to take that into account. Make sure we stop the people from doing the bad stuff, but insofar as we can, at least for a legislature and for a government, to be able to respond compassionately to the people that are hurting.
Chloe?
I mean, compassion is exactly what these kids need, and it's oftentimes what they're missing. I mean, a lot of these kids, they have their psychiatric issues are not being properly addressed. A lot of them have undiagnosed autism, and a lot of them have been victims of some sort of abuse or trauma. And you won't really see like the popular kid in the school transitioning. It's often the kid who is outcast, doesn't really have very many friends, isn't very active in like school sports or clubs or anything like that. They're just lonely, and all they really need is they need to know that they're loved.
Absolutely. Very well. Compassion as you're approaching the subject as a legislator, how does that play in?
Well, I mean, I think I should begin by just saying, Chloe, I want to apologize to you on behalf of my colleagues, because, and every other young person like you that I think is just getting ground up in the gears of what has become political activism and pseudoscience. And you deserve better than that. I feel like my profession failed you as a person, as a human being that was crying out for help, that needed guidance. And I feel like we failed you. I feel like we lied to your parents, and we lied to you when we told you that this is going to solve all your problems, that this is totally reversible, that, nothing bad's going to happen. We are not normally given the ability to act in a way that is that ethically and morally irresponsible as doctors. We are most often held to a much higher standard. When I administer anesthesia to a patient, I have to explain the risks and benefits thoroughly, and including the possibility that you might die. It's very unlikely, but it could happen. And yet I feel, listening to your story, like you never had that. You never got that. And that you were basically brought along almost on a tidal wave of sort of activism with very little actual compassion and very little actual science and disclosure and truth. And I feel like we owed you better than that. But what I want you to know is that we not only regret that, but I'm going to make sure that I know that you're not alone, in that there are a lot of detransitioners, and you have no access to medical care for your particular needs. There's not an insurance company I'm aware of that covers that. And I want to see that change too, because you know what? The least we can do is make sure that for the rest of your life you get access to the care that you need. And I just want you to know that you're loved, and that we admire your courage, and that people like me in the medical community regret what happened to you, but we're not going to abandon you.
Thank you, sir. That means a lot to me.
Well, I think that's a good place as any to wrap up. I wish we could keep this conversation going, but we do have very strict time limits. Taylor is waving the time's up sign at me right now, and she's not somebody you want to trifle with. We have a few minutes for Q&A, I believe. So our tradition here at the foundation is a question, is a very brief sentence that ends in a question mark and an upward inflection in your voice. Do we have a mic going around? I can't hardly see with the lights, so just pick somebody.
How can we make these billionaires, these nonprofits, these people who are forwarding their cause to experiment with children and getting parents to go along because they fear for their child maybe committing suicide? Okay, you don't want. Okay, how can we make those people fiduciaries where they can be sued in court if they and be forced to provide that insurance to children for the rest of their lives because they depended on these fiduciaries for ruining their life, or at least for ruining their lives.
Have you seen anything like
Well, so many of the bills that are being debated right now are designed to do this. So creating so-called private rights of action, which basically empowers individual people to be able to sue doctors for these procedures. Now, once a state has prohibited, it's very hard to get insurance to cover it, right, in any case. But creating a private right of action. And in Texas, my understanding is that actually that's probably possible in examples that you can show some kind of malpractice, at least after this bill passes, because the reality is that kids almost by definition can't give informed consent on this. You just can't. You're 13 years old. You don't understand the full implications of this. And so I honestly think the way that this ends in the short run is massive class action lawsuits against the clinics that are doing this. And I'm going to, frankly, enjoy watching every minute of it. That's got to happen, So that's a step. The billionaires, I'll give you a few names. Martine Rothblatt. So they're mostly men presenting as women. Martine Rothblatt founded SiriusXM. Jennifer Pritzker, okay, so that's, again, a name. And then a guy named John Stryker through the Arcus Foundation. So he gave, through his foundation, $15 million, one grant to the ACLU to fight on the other side on this. And so there's some billionaires on that side bankrolling this. There aren't really on our side. If any of you are billionaires, I hope you'll hear this. But then the final question was, what happens with medical care for detransitioners? That is still to come. That's something that states are going to have to take up, because at the moment, right, first of all, the other side claims that they don't exist. They claim that there are no such thing as Chloe Cole. They'll literally say that with her in the room. And so that's going to be, these bills are step one of what is going to have to be a rolling barrage of bills over the next couple of years on this stuff.
And Chloe, you had some news last week that's kind of along those lines and holding some people accountable.
Yeah, last week I filed a lawsuit against multiple parties, actually. My healthcare provider, as a whole, the hospital that the hospital where I underwent the surgery, the surgeon, the gender specialist who referred me to the surgeon, and the endocrinologist who put me on hormones.
Thank you very much. Chloe, you're loved, and you're beautiful. God bless you.
Thank you, sir.
What I would like to ask you, this is something that applied to all the other lectures that I heard yesterday and today. What infuriates me and a lot of the American people is how the words have been hijacked. Is there anything legislatively, academically, that we can do to turn that around? Because the use of words ESG, DEI, gender care, they don't mean anything. I mean, at least they say they are going to mean they do good for people. So I'd like to know where we're going on that, and maybe TPPF can become the Frankfurt School reverse.
Chloe looked at me when you asked that question, like, who's answering this? Yeah.
That's a heritage question.
No, it's absolutely a great question. That's right. There's pushback on the SG and the DEI stuff, so that's a subject for another panel. I have opinions on it. Something that's going to need to be done is something that never needed to be done until now, which is a really clear definition of sex, male and female, in law, in state law. So the federal government under President Biden right now is in the process of trying to change the meaning of the word sex in Title IX. Title IX was the 50 years ago, right, the law that is mostly responsible for the explosion of female sports. So they want to redefine sex to include gender identity. Now, as I mentioned a little while ago, gender identity isn't a synonym for sex. It's a different thing. And so we have all these laws in which we just presuppose everybody knows what male, female, and sex are, and then sometimes have to find them. And so states that don't have really clear, precise definitions grounded in biological reality of these terms, are going to need to do that, and then to distinguish them from gender identity. And then this complicated word gender, which used to be a rough synonym for sex, and then came to be separated from it, and then became a stand-in for gender identity. So you can see this is work for philosophers and lawyers to nail this stuff down. But the states have to do this, and they're going to go head-to-head with the current federal government, who is trying to do the opposite, but it has to happen.
And I'm going to dovetail on that if I can, and I think the other piece of the answer to your question is that we need to have better control of what's going on in education. These concepts are easy to force on society because there are willing foot soldiers in every school and every college and university across this nation, and that's where the problems start. So you think about, the effects of social transitioning in school and pronouns and, all of the different things that are going on and how that relates to this particular issue. That is all learned behavior. The people in our schools that are advocating for that stuff didn't just come up with that on their own. They learned that from the people that taught them how to be teachers and counselors and psychologists and stuff like that. And so we need to start holding these institutions accountable, and we need to start holding the non-governmental organizations accountable, like the American Board of Medical Specialties, like the ACGME, like the other professional societies and agencies and organizations that are out there where there's really no accountability outside of their own society for any of the things that they say or do. They hold themselves out to be experts, and they promulgate dogma, and that used to be okay when the science was good and the science was valid, but they have sold their souls on this stuff, and it's time for us to hold them accountable.
And I just want to jump in as well. As an attorney, I am a firm believer that words matter and words have meaning. It drives my wife crazy when we're having discussions at home. But the answer to your question is, yes, there are things that members like Representative Oliverson can do, but you don't have to wait for him. You don't have to wait for the Texas Public Policy Foundation to do something about it. Every single one of you in this room can do something about it from the moment you leave this room, and that's do not comply. Words have meaning. The left is trying to erase those meanings, redefine those meanings, muddy those waters. Don't play the game. That's what you can do.
Well, Andrew, you almost took my question. Dr. Oliverson, sir, what can we do as the people to help support your bill and protect kids in the law?
Great question. I would first of all ask you to reach out to your lawmaker and tell them to co-sponsor or co-author our House bill, which is House Bill 1686, or if they're in the Senate, our Senate bill, which I'd 625, and that's a big first step. And then the second thing is support them, encourage them. I personally believe that we will win this argument on the facts and on the reality, and I believe the other side knows that, which means that they're going to do what they always do, which was resort to demonizing the people on our side as a way to discredit and destroy their reputation, because that's really all they have left. They don't have the ability to argue from a facts-based perspective on this because the facts aren't on their side. House Bill 1686 and Senate Bill 625. Yeah. And friends, we need as many lawmakers, Republicans, Democrats. I truly believe this is a bipartisan issue. This is about kids. The left in this country always likes to talk about how they care about kids. This is about protecting kids. Okay, you'll notice if you read this bill very carefully that we're not talking about what we're doing with adults here. We're talking about protecting kids. We're talking about protecting folks in that very fluid, very stressful, very changing period of time that we all have gone through, which is adolescence. And we all remember what that was like. It's not easy. And then you throw all this on top of it. This is the wrong time for these decisions to be made, and we've got to We've got to stand up for kids. So whether you have Republican or Democrat, urge you, reach out to them, get them to sign on to our bill.
So I understand we're talking about kids and under the age of 18. When you've got someone who goes into college, into grad school, they're a legal adult who can sign an informed consent waiver of liability that was adapted from a bungee jump operator. I mean, there's no standard to waive your liability as an adult. What would you say to someone who is living in that bubble, has all the answers, has all the just has been saturated in that media and social world where they have all the answers, and this is for Chloe, to what would you say to them as a person who has detransitioned, and what would you say to the parents other than compassion about how you reach someone who is a young adult but still really hasn't experienced adulthood, who has seen transition as the answer? Thank you.
Right. I mean, transitioning both socially and medically will affect you in ways in pretty much every area of your life. And that's not really addressed by the trans community or by doctors who promote this. I mean, it affects things not only like your ability to have kids, but also how you experience sexuality, your libido, sexual function, and pretty much every area of socialization, I would say. And you don't really realize just how much your life changes until you're actually in it. And to the parents and families of young adults who are struggling with this and considering transition, I mean, there's not really as much you can do if they're legally an adult, and because you won't have access to their medical records, you won't be able to make medical decisions for them. But you can talk to them about it, you can voice your concerns and have an honest discussion about it. I think that's the most important thing that you should do. But it's also important not to ambush them. Just to have a completely honest, open conversation about it.
We have time for one more question.
Chloe, I'm the mom of 4 girls, and you just move me. I mean, I'm so proud of you, and the woman that you have become is just beautiful. And I know that you get attacked from the other side a lot, but I want to just thank you for your courage and for helping millions of kids that don't even know and will never know who you are. I just admire you. I do have a question. If it's too personal, don't feel like you have to answer it, okay? But could you just tell us a little bit about the ongoing medical care that you will need for the rest of your life?
I mean, right now I'm kind of in the dark about a lot of things. Like, as I've said, I'm experiencing complications from all 3 of the main treatments, from the blockers, from the testosterone, from the mastectomy. I haven't gotten my bone density checked, but I probably should, because I've been, a few years after I started transitioning, I've started experiencing some joint pains, and this has worsened after going off of it. And now I get like shooting pains on my back, and they're kind of sporadic, fairly infrequent, but I don't really have any way of predicting them, and they're becoming a little bit more painful as time passes. And from the testosterone, I have some urinary tract issues from that. And I'm not really sure why that is. I mean, I've tried to reach out to Urogyne, and again, all I could really manage to get was like a Zoom call, and like they tried to diagnose me over the phone. At first it was, oh, you're probably having urinary tracts, let's give you antibiotics. And then eventually it became, well, maybe you just have an oversensitive bladder, you should take this medication. I mean, this is kind of a pattern that I've seen with pretty much every other medical issue I've had, unfortunately, and I can't really trust my doctors or my my healthcare provider in general anymore. And from the surgery, I didn't really have any complications other than the ones that were on the forums. Like, obviously, I won't be able to breastfeed. Like, the sensation and appearance will never be the same. But I thought I was healing fairly well up until about 2-year mark when the skin grafts they use started to fail, and I haven't gotten any answers on what's happening to me.
Well, thank you all very much for being with here. Chloe, Dr. Richards, Dr. Oliverson, thank you for joining us today, and thank you for your work on this important issue.